I want to welcome Claire Mortimer. And I met Claire in Maine this past summer, and I was so impressed with what she told me about her work with flower essences and mental health. So I've invited her to give a presentation at IMHU, and thank you so much for coming and introducing yourself today, Claire.
Hi, Emma. Thank you so much. Yes, I've been using flower essence therapy since the early 90s. That's when I was first introduced to it. I've been practicing medicine for 35 years, and I have been integrating natural healing techniques with allopathic medicine for most of my career. And I find that, so I'm medically trained, so I'm trained to diagnose and treat mental health issues. And I have used psychotropic medications in the past, but I frankly find the flower essence therapy to be much more effective in some ways, and especially in moving people forward from a stuck place emotionally. And so, but I do want to make clear that there is not a problem with someone being on a psychotropic medication and using the flower essence therapy. They do not interfere with each other or interact with each other because they work on a very different level. Psychotropics work on a neurochemical level. Flower essences work, if you will, on a vibrational level. Flower essences use the entryway into the body of the emotions as the indicator of what flower essence will help that individual. It's kind of an offshoot of homeopathy in that the person who developed this 100 years ago or so in England was a trained allopath, a trained homeopath, and found that emotional and spiritual problems were addressed better with this system. It is derived from mostly flowers, but not only flowers. And it is potentized the way that homeopathic remedies are potentized. And each flower remedy has a particular picture that resonates for it. And it's the picture of the condition, the emotions, the thought patterns, the behaviors that are specific to that flower essence. The person who you're treating or caring for is required to go deeply inside of themselves and to really deeply look at what is going on with them emotionally and be able to articulate it well enough and specifically enough so that the practitioner can find the right flower essence that corresponds to what that person's situation is.
Can you give us an example, like tell a story about someone that you've treated and how they responded to the flower essence therapy? Because for some people, this is highly unusual.
I can't think of minor things off the top of my head, but the most dramatic situations that can be addressed quite effectively are situations of trauma. I mean, a lot of people have probably used or heard of rescue remedy. Rescue remedy is a component. It has 5 flower essences in it, and it is specifically to address the immediate effects of trauma or of anxiety. I could tell you somebody who I had as a patient when I was still doing primary care. I'm in a private practice now. Somebody who had multiple hospitalizations for anxiety disorder, panic attacks, etc. I told her to get the rescue remedy. I actually gave her my personal cell phone number so that if it was needed, I could talk to her at any time. she called me one day and she said, I'm crawling out of my skin. I can't stand it. I'm on the front steps of the psych hospital. I'm going to admit myself. And I said, wait a minute. Do you have your purse with you? Do you have the rescue remedy with you? I said, do you have a water bottle? Yeah, I got a water bottle. Okay, 4 drops in there and sip it slowly and call me back in 10 minutes. 10 minutes later, she called me back. She goes, I don't know why I wanted to go in there. I don't feel that way anymore.
Uh-huh.
I mean, that's a typical kind of urgent situation.
Yes.
Where it addresses the problem.
Yes.
Very
that
clearly, very firmly, but gently.
Very dramatic story. And I came to Rescue Remedy myself through homeopathy. So I think most people do associate it with homeopathy.
Yeah.
And wonderful to hear that kind of result. Now, Claire, you were trained in a relatively conventional way, right?
Well, I first went through training with the flower essence, the Bach Flower Essence organization, which is based in England, although they have trainings in the United States also. Mm-hmm. The original 38 Bach Flower Essences were discovered and developed by a man named Edward Bach in England about 100 years ago. Over the last 15 years or so, there is another organization called the Flower Essence Society that is based in California, and they have taken the basic principles and techniques of deriving flower essence therapies from flowers, and they have applied that same principle and technique to many, many more flowers. So the original repertory that I was trained in and am still most familiar with are the original 38 Bach flower essences. But through the Flower Essence Society, and I've been through their advanced training, there is a much wider repertory of maybe about 150 flower essences.
Wow. So we just have a very brief time today, but I want people to know also that your training in the conventional world was a springboard for your going deeper into exploration of other avenues. Would you like to just tell people briefly what your conventional training was before you went into the flower essences?
Well, actually, before I had medical training, I had already been studying herbal medicine and homeopathy and acupuncture and all sorts of things. I got into conventional medical training because I felt like I wanted to bring those techniques into a setting that is an acceptable medical conventional setting. That didn't exactly work out for me because the settings where I worked wouldn't allow me to counsel people and use those other techniques. So, now the private practice that I've been carrying out here in Blue Hill, Maine for the past 7 years or so does bring together all of those elements and many more that I have added to my. I just say I have a larger toolkit than most people do.
Great.
I use Reiki, I use flower essence, I use homeopathy, I use herbs, I use emotional freedom technique, tapping, and all kinds of things.
Thank you.
Many paths to healing. Many paths to healing is the name of the practice.
Thank you. And I will be posting that so that people can see your contact information clearly. Now, unfortunately, the internet connection is quite poor right now, maybe because of the snowstorm we're having. So I think it's time that we said thank you very, very much for showing up on this snowy day and giving us some more information about what you do. And we'll look forward to the longer presentation that you're going to be giving quite soon at IMHU. So thank you so much, Claire, and I look forward to the next time.
Thank you.
Bye-bye.
Bye.